Today I'm going to take you through a chronic back pain workout that's going to help relieve the pain in your back and probably up into the ribs or down into the hips. Why we want to work from a brain-based perspective for chronic back pain is because simply the brain controls everything. So muscles will try and do their jobs because the brain is telling it that's what it needs it to do in order to function. So you wouldn't be able to move if a muscle didn't do its job. So the brain will tell the muscle to do its job above everything else. Now, if the muscles are too weak, what will happen is they'll start trying to do their job more and more and more, and that just means they'll tighten up and tighten up and tighten up as they put more effort into their job until eventually they spasm, and you'll either get pain from that spasm itself, from that fear of not movement, your brain will generate the pain signal, or you could even hinder how a nerve moves through the muscle because you might just clamp down onto that muscle. So a lot of problems with chronic back pain are nervous system based, but also strength based because the muscles are simply not strong enough to do their job. So the first exercise we're going to look at is strengthening the two big beasts of muscles either side of your spine that help support your spine and join your trunk to your lower body. So that's the QL, the quadratus lumborum. These muscles, because of our sitting at desks in the modern world, are usually super weak, so therefore super tight. So what we're going to do is, you don't need a weight for this, but it does help. We're going to use a small, light weight. Eventually you want to build up once you start getting a bit of strength back into them to quite a substantial weight. But for now, even if you just have a book in your hand, it just helps to feel the pattern of the movement. So the hand that the weight is in is going to be the same foot that's in the front. So I'm going to cross my leg over the front of the back leg. So the same hand that the weight is in is the lead foot. This front leg can bend. This back leg must stay totally straight. That's where the benefit is from, okay? Weight wherever you feel most comfortable, either 50-50 or mostly in the back leg or mostly in the front leg. From there, we're going to fully, as much as we can, bend to the side without going over forward or anything. We're going to bend to the side. From there, we're going to keep the weight in the inseam, so the line of the seam of the jeans or trousers as it goes towards the ground. So to do that, we don't come forward. What we do is we kink the hip out at the back and up. We're going to do 5 on this side and 5 on the next side. So fully bend to the side, kink that hip out and up. So you should feel this stretching down the back of the leg in through the glute, and then you should also feel the QL, or if you can't identify the QL, the lower back should feel a bit on the pumped side after doing these, especially if you've been suffering with chronic pain for a while. I'll do the next set from the side so you can see the motion from the side and up. So from the side, what we're going to do is, again, this weight means this leg is in front. Okay, this leg can bend, the lead leg can bend, the back leg cannot. So we bend fully to the side first, but still keeping that weight down the inseam of the trousers. We kink the hip out to the back and up. So again, all the way over and down. All the way over and down. And then I will just do the last 2 from this side so you can see the way the hip moves. So all the way over and down. All the way over and down. Okay, we're going to do that once more on each side. Okay, so back to the first side. First leg back in front. Front leg can bend, back leg stays totally straight. Fully side bend over, and then kink the hip out all the way to the floor, making sure not to bend forward. It's always down the inseam. So we're making sure that the back has to laterally bend, has to rotate, and there's a slight bit of flexion in there. All three movements which combine to make the infinite number of movements the spine's capable of. If you have a deficiency in any one of those, you're going to end up, more than likely, with some form of back pain. Swap sides. So all the way to the side, all the way to the floor, or as close to the floor as you can get. All the way to the side, to the floor. Two more. All the way to the side and to the floor. Last one. All the way to the side and to the floor. There we go. So that's called QL side bend. Next up, we have an exercise called a frog stance zenith rotation. The reason we do it in a frog stance is so that you can't cheat by moving your hips. So the rotation has to come from the spine. What we're going to do is we're going to make a nice little box shape, first of all. And then you're just going to, as far as you can, slide your knees out into what's known as a frog stance. If you can't, you can do it from here. Just be careful about how much your hips sway when you're doing the movement. You want to keep them nice and still. But if you can, frog stance is best, so you don't need to think about it. We're just going to do 5 on each side. We're going to go through it twice. So hand on head, all we're going to do is touch elbow to elbow and then reach to the roof. And elbow to elbow and reach to the roof. You see the way it makes sure my hips don't cheat. As Shakira says, the hips don't lie. And relax and swap sides. So hand on head, elbow to elbow and to the roof. 1, 2, 3, 4, and 5. Now again, we'll go through for the second time. If you need to, give it a quick shake out. So pause this, give yourself a shake out, and then get back into the frog stance. So set number 2. 1, 2, 3, 4, and last one, 5. Swap sides, last time, last side. 1, 2, 3, 4, and 5. Take a little break for a second, give your arms a shake out. If you have any cramp, give it a shake out before we move on. Our next exercise is called spinal waves. We have so many vertebrae that we should be able to control individually, but we just don't. It's a product of modern life and the fact that our spines don't move in the way they were intended generally because we don't have that much variety of movement. So what we're going to do is we're going to start building that control back in. Because if you can control a joint, the joint doesn't freak out when you go to move, and therefore the chances of injury are a lot less. So we're going to start on all fours. So hands on their shoulders, knees under hips. And what we're going to do is we're going to just nice flat back, and then we're going to tuck the lower spine under. And that's going to cause a domino effect. So you're trying to just move one spine at a time, like a slinky or a Mexican wave, all the way up through the thoracic into the cervical. From there, you stay in this hump position as you then try to arch the lower back, and that will slowly pull the thoracic and then the cervical. So you can see why it's called a wave. So we're going to do 2 sets of 5. So number 1, curl at the lumbar, curl, curl, curl. You feel a stretching on your lower back. That causes the thoracic to curl, causes the cervical, and then keep the cervical up there in the thoracic. Start arching the lumbar, and that brings everything else. It's a variation of the classical cat-cow. So curl that lumbar, push the thoracic up there, then the cervical and down. Keep everything pushing down as that lumbar curves. Then that brings everything else with it. And likewise, that's the end of rep number 3. 2 more. And last one. If you need to, give yourself a little break for a second, and then we're going to get into set number 2. Okay, so again, hands under shoulders, knees under hips, nice flat back. We're going to start with the lumbar curve first. And then that brings the thoracic and the cervical. That all stays up there as the lumbar starts to extend and arch back. That brings everything else. 1. All the way up. And back. That's number 2. That brings everything else. That's number 3. 2 more. Curve. Brings everything else with it. All the way up there. Stays up there as the lumbar spine starts extending. And that brings everything else, thoracic and cervical, with it. Number 4, last one. And we're going to curve. Push everything else up. 1 at a time. Try and go vertebrae by vertebrae. Try and picture it in your head as you're doing it. Okay guys, initially when you're suffering from chronic back pain, you might not be able to get into classic stretches such as the couch stretch because it's just too intense. So what we're going to do is we're going to still get at the psoas, because the psoas is super important in back pain because it goes from basically hip flexors up through the hips and into your lumbar spine. So if that's chronically tight or weak, as we like to call it, that's going to tug on your lumbar spine as well as the nerves that innervate from the spine there. What we need to do then is find an alternative, okay? So we're going to do a long lunge hip drop, but we're going to keep the back knee on the floor, okay? From that, we're going to then lift the leg. All right, so we're in a kneeling position. 1 foot out in front, so 90 degrees, 90 degrees, okay? From there, we're going to put a hand out and move the foot out slightly so that we've got a bit of extension here in this back leg. We're going to Elvis hips, tuck and tilt under, and we're just going to drop to the floor with this arm supporting 5 times. And then just drop that hip here as close to this floor as you can. Squeeze the bum, make sure you're pushing that hip forward at the same time. 2 more. And really lift that leg in to the floor. And then we're going to swap sides. So we're going to come back to the kneeling position. 90 degrees, hand slightly out in front. So you make a big triangle and try and match it with the foot. So you need to lean forward. From there, tuck and tilt, squeeze those elbows, hips, and drop that hip down to the floor and back. Down to the floor and back. Keep squeezing that hip forward. Ideally, you want to imagine pushing your hip to between your front foot and your hand. Like you're trying to drag this leg along the floor. Last one. Going to come back to the start position again. 90-90, hands slightly further in front. Move that foot out to meet it. Push that hip forward as if we're trying to aim for here. Squeeze the bum and drop. This is a good alternative to the couch stretch as it introduces a stretch into that hip flexor, into that psoas, but it isn't as intense as the traditional couch stretch. And then we're going to swap sides for the last 5. So 90-90, hand in front, move this leg out to meet it, squeeze that hip forward and drop. 1, drop, 2, and drop, 3, drop, 4, last one, and drop, 5. And that's an alternative version of the couch stretch, the long lunge hip drop. We're going to move on now to one of the most important things in back pain, and that's actually proper breathing. Diaphragmatic stretching as well, because the diaphragm actually attaches in to your lumbar spine. So if your diaphragm isn't being used well, and sometimes it can be in spasm or have scarring on it, it can again cause issues with back pain and the lumbar spine. So what we're going to do, we're going to come to lying on our backs. From there, hands wherever is comfortable. Ideally, they're up here above your head, but if that's too painful, they can be out by your sides or flat down by your sides. Ideally though, up here above the head. From that, what we're going to do is tuck the pelvis under and lift up so that our bums are off the floor. We're then going to breathe in through the nose fully, inflate as much as you can. And then we're going to release through the mouth until we're totally empty. When you think there's some left, there's lots left. When you even think that you're empty, there's still some more. So we're going to breathe in and then release. Keep going. At that point, when I got fully empty there, is when we would start to slowly roll down vertebrae by vertebrae, and at the end, we're just going to drop to a side. Okay, we're going to do this on each side. We're going to do it 3 times each, and that's the finish. So, pelvis under, breathe in. Now exhale, and roll down. Recovery breath. Come back to the start. Then roll up and inhale. Exhale. And roll. Recovery breath. Inhale and roll the pelvis up. Exhale. Roll down. Recovery breath. Inhale and roll the pelvis up. Exhale. When you're empty, roll down vertebrae by vertebrae. Recovery breath. Last time on each side. So inhale and roll the pelvis up. Roll down. Recovery breath. Inhale and roll the pelvis up. Exhale, and when empty, roll down. Recovery breath. And come back to sitting. So guys, that is a few steps for a nice little follow along to help with chronic back pain. The key is to learn how to breathe properly so that the diaphragm is functioning properly and getting fuel to the brain and the nervous system, but also to strengthen the muscles that support the structure of the spine. Through daily living, they become weak and then they get tight, which indicates a problem, and the brain will generate the pain signal. So by making them stronger in specific ways, we can actually fight back and beat chronic back pain. Hope you find that useful. Incorporate a few of these into your daily routine, especially things like the diaphragmatic stretch and the QL side bend. And we will see you either on our membership, on our mailing list, or hopefully on social media. We can have a proper interaction and get to know you. Have a good day.